Um, that's a great question. In 2026, the definition of heart health is totally changing. It is beyond managing your diseases such as diabetes, blood pressure, cholesterol, smoking. It is about taking care of yourself in whole, managing your stress, managing your sleep hygiene. It is just not fixing a number such as cholesterol number. It is being consistent with healthy habits such as exercise, lifestyle modification, and being active. So we have learned over the course of years and years that putting stents in the heart, giving fancy drugs basically is not the solution. Actually, it is the opposite. In 2026, heart diseases unfortunately still is on the rise. I'm sad to say that in 2026, still the number one cause of mortality, leading cause of death in the population of the United States and all over is cardiovascular disease. And it's sad because at the same token, it's a preventable disease. Focusing on small lifestyle modification, eating healthy, exercise, remaining active, and not be fancy about it, just remaining active, aerobics, physical therapy will keep you out of the danger. I'm so glad you asked that question. We get asked this question quite a bit from our patients. Most of the patients, when we are managing them in ICU, in the cath lab with heart attack, they tell us once the things are over that we never saw that coming. Sadly, that heart disease, you don't feel it. Such as, if you're in sports injuries, you fracture a bone, you have pain, you have symptoms, so you feel like something wrong. In cardiac problems, you can still have silent plaque buildup over the course of years. You'll still be working, active, and you don't feel anything. So the misconception, I would say, is that patients think they will feel that coming so that they can go see a cardiologist. Sadly, that's not true. It builds up over the course of years, and it's pretty silent. So we tell our patients, if you have risk factors such as strong family history of cardiovascular diseases, patients who have hypertension, tobacco use, cholesterol problems, high stress jobs, we want them to kind of seek opinion and consultation with healthcare providers, not to find a disease, to protect them from having a disease from developing. So as you have seen on social media, movies, we think that cardiac diseases presents only with chest pain and shortness of breath, as you see, on the television, patients holding their chest with their hand. There are other symptoms we have learned over the course of years, such as our, female population. We have atypical presentations. What does that mean? Sometimes actually decreased exercise tolerance. Well, I used to walk 20 minutes. Now, over the course of a few months, I just walk 10 minutes. I'm still walking, but my stamina has reduced. I'm walking only 10 minutes. That is one of the causes of probably a hidden cardiovascular disease. Patients who have, irritability in their mood swings, basically, decrease in their exercise tolerance, their sleep-wake cycle gets disturbed. All these things can be an early sign of a cardiac condition. Very, very important question. Patients ask this question us a lot. Genetics matter. Genetics really, really matter, but lifestyle is the most important part. And as you guys may have heard this in other social media, I always tell my patients that genetics actually load the gun and lifestyle pulls the trigger. So if you have strong genetic history of cardiovascular diseases, if your mom, dad have heart attack at a young age, and you are concerned that you may get this issue, yes, genetics matter, but if you focus on lifestyle modification, you remain active, you eat healthy, you do not use tobacco, you remain physically active, go to gym, exercise, manage your stress, your chances of getting cardiovascular disease is substantially lower despite having a strong genetic history. So in 2026, this is the time of social media, a lot of artificial intelligence, there's a lot of noise out there, and I tell my patients, do not get confused. There is a superfood epidemic going on. It's like, you open a Facebook reel and you will get confused. I tell my patients, keep it simple and keep it consistent. So what we need to do, being active, physical therapy, physical exercises. If you go to gym 3 times a week, 4 times a week, brisk walk for 20 minutes, and that is a physical therapy. If you go to gym right now, you have so many things. Sometimes, cardiologists like me get confused. You go to a different section to get your core, your legs. It's like so confusing. You don't need to be that fancy. Keep it consistent, such as elliptical, treadmill, even if, in your yard, walk around 20 minutes, 3 to 4 times a week. That's regarding the physical exercises. And regarding the diet, mostly there's a lot of noise about one particular type of diet, other type, all or none phenomena. Eat just ABC, do not eat XYZ. I am a cardiologist of opinion of moderation. I never tell someone to stop everything altogether or eat only one thing all the time. We are human beings, we have desires. So what mostly we recommend is Mediterranean-based diet, which is a very balanced diet of meat, protein, vegetables such as seafood, chicken breast, nuts, olives, and keep that in moderation. You do not need to go to a supermarket and buy expensive food. Superfood epidemic, as we discussed. Keep it simple and keep it consistent. So whenever I recommend any pharmacological treatment, whether that's drug therapy or it's some sort of an intervention, I rely on strong clinical data. I feel like the data should drive anybody's practice. So to answer the question about pharmacological ways, medical ways of reducing your cholesterol, yes, statin-based therapies have a strong role. And going back to all the randomized controlled trials, which were done in patients with strong cardiovascular diseases or risk factors, there is a profile which we create. When I talk to my patients in the office, I look at them in general. So there's a risk calculator, which is recommended to be used from American College of Cardiology. It's atherosclerotic cardiovascular disease risk calculator. You put your age, your blood pressure, if you have a high blood pressure, your race, your smoking history, your body weight, and then that calculator, which actually goes over a big cohort of pools of patients, that comes with a risk number. If you cross a certain percentage of risk, that there's a 10 years risk of cardiovascular disease, yes, we recommend to use statin-based therapies. If your risk is very low, depending upon that profile, which is again based on years and years of research, we do not recommend to use statins. But that still does not mean that the lifestyle, you should stop, that you are healthy, you do not need to move. You still need to do, if you're not a statin candidate, you still need to do exercise and eat healthy and control your risk factor. So as of now, we have learned again from all this new therapeutic interventions and new procedures that we are actually investing a lot of our economy in building and innovation and treatment and all that stuff. But again, what I see in next 10 years is the focus should be on prevention. This disease is a very much preventable disease. We need to go back to our basics. We need to control the risk factors. That's the future. We cannot sustain as a nation building all these drugs. Some patients cannot even afford it. Insurance comes into action. Some patients cannot even have access to these new treatments. But everybody has access to a healthy lifestyle, such as being, active 3 times a week, exercise, eating in moderation, eating healthy, and controlling your risk factors such as stress, sleep-wake cycle. That's what I see the future. We cannot sustain like that with this epidemic going forward. So we have learned that stress management has a key role in preventing diseases, cardiovascular diseases. What stress does at the level of your blood vessels, actually it increases or it creates a fight and flight type of state. So what it does, it increases your stress hormones such as cortisol. They circulate in your circulation, and that increases inflammation in your arteries. And we do know that from autopsy studies that patients who have plaque blockage in their circulation, it starts at the level of inflammation. First, you have inflammation, that progresses to a blockage, that progresses to a heart attack or stroke. And going back, what caused that inflammation? Stress has a very important role in causing oxidative, inflammation in the vessels. Now, the question is, stress is everywhere. How do you manage the stress? Keeping things simple, such as, maintaining a sleep cycle about 6 to 8 hours of uninterrupted sleep can help you manage the stress. Decompressing stress, going to the gym, exercise, running also helps significantly with stress. To be very realistic, you cannot eliminate stress, but we can mitigate by doing lifestyle modifications such as exercise, maintaining sleep-wake cycle, and staying away from toxic, environment. So you do not need to have a medical condition such as diabetes, blood pressure, active tobacco abuse to see a cardiologist. Patients who have strong family history of cardiovascular conditions, patients who are obese, patients who feel like they get short of breath, or they have these symptoms such as indigestion, chest pain. But if they look at their chart, they do not have those conditions listed, such as diabetes, blood pressure, or stroke. Where I tell my patients that if you have a strong family history, you are obese, and your exercise tolerance is decreasing, you do not need to wait to see a cardiologist to find a disease. It's time to protect you from getting a disease. So at least with these risk factors, I would say to see a cardiologist. The advice I would give to my fellow Americans is basically being consistent and keep it simple. When I say consistent, develop a healthy lifestyle, which is exercising at least 3 times a week, brisk walk for 20 minutes, and staying away from the noise of the superfood epidemic or health or expensive diet. Keep it simple, such as the Mediterranean diet, and eat healthy. If you eat healthy and you move, you're not going to be in the hospital anytime soon.